Complement-mediated diseases are rare conditions, and in Canada we have treatment for two of them, paroxysmal nocturnal hemoglobinuria and the atypical hemolytic uremic syndrome, or AHUS. PNH has had eculizumab available since 2009, and since then we've noted improved survival, reduced thrombotic events, and improved quality of life in these patients. More recently, we've also seen in the New England Journal that there seems to be safety when treating mothers who are pregnant with eculizumab. This ASH, there's also evidence that even in patients who are not transfusion dependent, there are significant improvements in hemolysis as well as quality of life parameters with eculizumab compared to just watching and waiting. And this is quite exciting and also very important work that has been demonstrated using our global PNH registry. When it comes to atypical HUS, this is an even more rare condition which has more complexity in terms of diagnosis, as it can quite similarly look like TTP, and those treatments are quite divergent, TTP being treated with plasma exchange plus or minus some immunosuppression, whereas atypical HUS again requires eculizumab for complement regulation and inhibition. There is work being shown this year at the meeting that shows that the longer treatment is maintained, the better patients do with AHUS. And in addition, the patients who stay on label dosing do better than those who have dose reductions. And when the experts were able to compare them to patients who stopped their drug for any reason, there was a reduction in TMA events and overall better clinical outcomes. Furthermore, this year there's also work that's going to be shown that modifies the HAM test, which used to be used for the diagnosis of PNH. This has been modified to actually assess for complement activity, and Robert Brodsky's group at Johns Hopkins has added in AHUS and TTP sera to the modified HAMS test assay, and they found that with 94% sensitivity and 100% specificity, a killing of 20.5% in their assay predicted AHUS compared to TTP, and all patients who responded to eculizumab had a positive result, giving them a positive predictive value of 100%. This is all very encouraging, and if this assay can be operationalized in the clinic, this would be something that allows us to make an on-the-spot or quite rapid decision between TTP and HUS, and will allow us to get drug faster, especially as the faster you give drug in HUS, the more likely you are to save organ function and possibly life.